All right. All right, so to begin with, a little bit about Prevent Blindness Wisconsin. Prevent Blindness Wisconsin is a nonprofit organization, and we are located in downtown Milwaukee. With the location, though, we do serve every county, and we are a statewide organization. So it's not just Milwaukee County, it's not just greater Milwaukee area. We do serve all counties in the state. We are a full-time staff of 7 currently. So for us to do our work, we do rely really heavily on our partners and volunteers. So that's why our statewide work is so important to us as well. When it comes to our work, we really have a variety that we do across the lifespan when it comes to vision health, vision education, and getting people into that further vision care. So we span from newborns all the way to older adults. Vision screenings, as some of you may know if you've been with us for a while, is really our bread and butter. But with that, we really want to make sure, one, people understand the system when it comes to making an eye exam appointment, or if it's specialty care they maybe need for their vision health, and how to make that a habit, a lifelong habit for them too, no matter what their coverage options are, and just general education. We really want to go over protecting our eyes, especially as we go through our life. They're 2 very vital organs for us to do everyday things and maintain that quality of life too. So I did mention briefly, we do have a smaller staff, so we do rely really heavily on our partners and our volunteers. Just a couple of our partners I'm going to mention this morning is we do partner with DPI, the Department of Public Instruction, the Wisconsin Head Start Association, different community and corporate volunteers too, university programs, high schools as well too, especially with HOSAs, key clubs. I'll get into that a little bit on how we train those students to help out our school nurses and school districts as well when it comes to implementing vision screenings in your communities too. And also the Wisconsin Lions Foundation is a very big partner of ours too. So just a little bit of an overview. This last fiscal year was a wonderful year for us. We were just about serving 350,000 Wisconsinites with our programming. And that's not just vision screenings. Like I mentioned, it's education, it's case management too. So we do really run the gamut when it comes to protecting vision health and making sure people are proactive with that too. When it comes to direct screening services, we served about 138,000, a little bit over, with those direct services. So children and adults, this does include. We conducted over 70 statewide trainings. This includes in-person and virtual, mainly more virtual. COVID did bring us that option, and it does seem to work a little bit more statewide with our partners, but I'll get into that too at the workshop. We do still offer in-person. So we will go over that too. And we have a network of about 1,400 certified vision screeners, including children and adults. So just a great year and some great statistics just wanted to share with you.
Probably, I was gonna print them.
Okay, because I'm thinking that's.
All right.
And then we can update the other ones that are in the.
Yourself, that would be wonderful, just so people can hear. So with this, I just want to go over what's the current need in Wisconsin when it comes to vision health. So Wisconsin, as some of you may know, is actually one of 9 states that does not require vision screenings for school age or preschool age children. There is no mandate out there. A lot of states do have that mandate where then the state and health departments do take on those vision screenings. Wisconsin does not have that. So the work that we do, the work that you all do, implementing these vision screenings, I want to take a moment and thank you, because you don't have to do this work. I know you're doing it out of the goodness of your students and making sure they can see clearly and have healthy lives too, and being able to see in the classroom and outside the classroom too. The second bullet point down here, the state of Wisconsin, so that we don't have a mandate. When it comes to the mandate, there is a recommendation that a child receives an eye exam or a vision screening by December of their kindergarten year. So really what we see that with that is a letter can go home as they start their kindergarten year, And it is asking the parents or caregivers, hey, were they able to get in for an eye exam or receive a vision screening? This is not something that is tracked by the state, though. It is just that recommendation in place. The other thing I want to mention here is currently, so this stat for preschoolers, we have about 1 in 17 preschoolers that has a vision problem. So preschoolers is our 3, 4, and 5-year-olds. About 3 years ago, that used to be 1 in 20. So we are seeing those vision problems creep in a little bit more. Some of that does have to do with digital device use, and also too, some screenings just have not happened for 2 or more years due to the pandemic as well. So we are slowly uncovering from that, getting back into the swing of things with vision screenings, but just want to mention it with that. If we're including Head Start children, that's 1 in 5 preschool age children, including Head Start children, that has a vision problem. So a little bit more of those risk factors coming in with Head Start kids as well. And then for our school age population, we have 1 in 4 school age children that does have a vision problem as well. So about 25%. So it's not a low statistic at all. Actually, our national office is doing another national survey, and I think those statistics we'll see are updated in 2025. So it'll be interesting to see what that looks like as we move forward, and move forward more so too with just the digital age and everything that we're exposed to as well. Okay, so step 1, I'm going to go over becoming a certified vision screener here. So as many of you know, our certification is valid for 3 years. So if you are brand new to vision screening, Prevent Blindness Wisconsin trains and certifies partners statewide as certified vision screeners. For this one, children specifically. So that is valid for 3 years after you receive the certification. And then after 3 years, we do ask you to renew. Now we get questions on, okay, why 3 years, Courtney, and why do I have to renew? To be 100% honest with you, we have constantly changing data and constantly changing protocol too over the years. They're really trying to make sure it's the most accurate as possible. I know it's a screening at the end of the day, but if we're out doing the task at hand, we want to make sure that it is the most accurate for those students who are vision screening. So that's why we ask for that recertification after 3 years. So there's a couple ways we can become certified. One is we do have live virtual trainings that happen about every month. So we actually have one coming up next Tuesday, October 31st, Halloween. And that is going to be from 10 a.m. to 12 p.m. And it is held via Zoom. So it's a live virtual training, kind of like today's workshop. We also have a couple other options too, if that doesn't spark an interest for you. We have a children's online training video. So it is asynchronous, it's self-paced. You would register with us, and then after you register, you get access to the training video. With that, we do ask you then, after you're done with the video, it instructs you in there too to schedule a skills check with one of our staff members. It's just to go over protocol, answer any questions you may have, and also just do a touch point with you. To fully certify you, we do need to do a skills check that is set by our national office. So we put that in place with the training video. And then the last option, I know I mentioned a little bit before, is we can schedule an in-person training for your school district, community. We just need a minimum of 10 people for that to travel and facilitate that training as well. So 3 different options out there to become certified, or if you need recertification, there are a couple other options here too for you. And if you have any questions on this, please feel free to shoot me an email after this, and we can certainly talk through the options a little bit further too. All right, so when it comes to our training, how long is it? So for the training in person, we average about 2.5 hours. So we go over all the training pieces, the common vision concerns we see in kids, different protocol for preschool and school age students with charts, but also our instrument-based tools. And then we go over what we call an in-person skills check. So going over the charts, making sure you're comfortable, having you practice in front of us, and to answer any questions that you may have too. The live virtual training, as I mentioned, is 2 hours in length, and we'll do the skills check right after the training during that time frame. And then if you choose to do the training video, it's about 1.5 hours, and then that 30-minute skills check at a later date as well. All right, so that's everything on training and certification. I'm going to get into here next. How do you start up that vision screening program? So like I said, we're really going to go back to the bare bones foundation of vision screenings and how we can set that up to make them most effective too. So first we want to choose the time of year that you want to conduct your vision screenings. There's really no set in stone rule that you need to do it in the fall. Fall is recommended though, just because if students are struggling to see, we just have a little bit more time to get them into care, and hopefully winter, spring, they have those glasses or treatment that they need to see clearly in the classroom and outside the classroom too. However, we have a lot of partners that conduct their vision screenings in the spring, and that is just fine to do as well. If you do this, we do recommend doing it more in the beginning of the new year, and to avoid later spring just due to follow-up and following those families to make sure they can get to further vision care. It just gets a little bit more difficult over the summer months. So fall or spring, yes, fall is the recommended option, but it's not a set in stone. You need to do it in the fall time. Okay, so once you choose the time of year you want to hold your vision screening, we then need to notify parents and caregivers on the vision screening occurring. I know every school district, every center that we work with has a little bit of different protocol. If you do need permission forms signed, that's fine. We do have different templates that we share with our partners. With the email I sent out yesterday, there should have been a folder in there that included vision screening announcements for everybody. And there is a sample announcement on vision screenings occurring. You just fill in your school information and you can send that out via email to parents or caregivers, Infinite Campus, or put it in your school newsletter just to let them know that it is going to be occurring. For us, we do recommend and we do conduct, if vision screenings are implemented by our staff or volunteers, an opt-out approach for families. Like I said, every school is going to be a little bit different with that. If you do need signed permission forms, it just gets a little bit tricky because if you're collecting those forms, some students and families may not turn them in. They get lost in the process. So that's why we use the opt-out method. Here's the announcement. We're vision screening this day or this week. If you do not want your child to participate in the vision screening, please let the school know or the teacher know. And then that child does not need to be vision screened. Otherwise, we would vision screen everybody unless we are stated otherwise. So this is just an example. At the end of the workshop too, I'll show everybody the different attachments I sent. I did get a couple bounces back just due to, I believe, some firewalls for some emails. So if you didn't get an email yesterday with all the resources, I do have your names down too, and I'm going to try some different attempts to send everybody those as well too. But this is just a sample of an announcement, like I said, email, newsletter, or via Infinite Campus, just to let the parents or caregivers know that this is going to be occurring. This is a sample permission form if you do want to send it home too. I have two different permission forms in those resources for everybody too. One is if you do need them to say, yes, I agree that my child can get a vision screening, or this one is just the opt-out method too. Okay, so once we choose our time of year and we choose our date and let the parents know of that date, we want to notify the teachers. All right, so we want to notify them and the grades too that these vision screenings will be occurring in, just so they know they can plan in their schedules too, and it's not just a surprise on a Monday morning or whatever it may be during the week. So we get this question a lot: who and how often should we vision screen for students? So we go off of our national office, the National Center for Children's Vision and Eye Health. They follow Bright Futures guidelines. And through Bright Futures, they recommend, and we follow, to conduct vision screenings for students annually for 3, 4, 5-year-olds. So 3K, 4K, 5K, and first grade. And then after we hit first grade, we recommend, on here it says the ages, but we recommend then 3rd, 5th, 7th, sophomore year, and senior year. We see as we get into more middle school, vision screenings may not occur as often just due to capacity. And that's a very common thing that we see across the state. So you may ask, okay, Courtney, why are we vision screening every year for mainly the littles, preschoolers and first graders? The reason we do that is because the critical growth period for a child's eyes is between 3, 4, and 5 years of age. The reason we recommend first grade too is because if there is a vision concern that was missed maybe, we still have that year to try to fix it and treat it. What I'm getting at here is more of those concerns that can lead to permanent vision loss for students. So that would be amblyopia, or what we call lazy eye, and strabismus, or crossed eye. So if we don't catch those conditions early, typically we want to catch them in latest first grade up to 7 years of age too. Otherwise, it's really hard for that student to regain that vision back with treatment. So we want to be proactive and try to catch that early and stop it in its tracks before we have that vision loss occur. So that's why we recommend every year for 3, 4, and 5-year-olds and first graders. And then we go to every other year for our vision screenings. When it comes to middle and high school, we don't see it as much with capacity, but also too, a lot of students we may find, and you may find this too, have glasses, but they don't like to wear them. So the hope is with the younger students, we can start that habit young too, and they can continue to wear the glasses as they get older. And also too, older students are more likely to verbalize with you, I can't see that, it's blurry, I'm struggling too, opposed to our younger age students too. Okay, so we want to notify the teachers. So what we want to do here, everybody's a little bit different. Gather class lists of the grades that you're going to be conducting the vision screenings on too. I will share with everybody too in the resources. We got a couple different methods. If you want to just do it off of the class list or attendance list and write the results on that, that's fine as you conduct vision screenings. Otherwise, there were a couple copies that I shared with everybody on putting the student's name into some Excel sheets, or putting it into a Word document too, or you can write them down physically as well. All right, then we want to organize the vision screening for the dates and times that we set. So we let the teachers know, and now we want to make sure we have the class list ready to go. As mentioned, there's a couple forms that I'll share with everybody at the end. This is just a sample. You can print this, you can fill in the child's name or copy it over to. It's just kind of nice. You can fill in the age, if they wear glasses, yes or no during the screening, if they've been absent, any appearance, behavior, complaints you noticed during the vision screening, and then just a simple check the box pass or did not pass, and which eyes as well. So that's just a sample. We mainly use this for more so of our preschool population. All right, so then we want to organize how much time do we want to allot when it comes to our grades that we're screening. So for first-time screeners, we typically see per class size, if they're larger classes, such as 25 or more students, to average about 30 to 45 minutes per class, especially if it's your first go around, or if it's high school students coming in. We want to make sure they get comfortable, feel confident, especially if it's their first screening too. So for 3, 4, and 5-year-olds, this is going to take a little bit longer. Okay, we typically use the iCheck booklet. If you use an instrument-based tool such as the Plus Optics or Spot, then it goes a little bit quicker, I would say, but we average about 5 minutes per student when it comes to our preschoolers. School-age students, so first grade and older, a little bit quicker, about 1 to 2 minutes, depending if they're really struggling. It can take a little bit longer, but just to give you a little bit of a marker and just to notify you kind of how long it could take for, different grades as well. We do recommend to schedule more time per classroom because it can fluctuate with every class. First grade you might zip through, and third grade might be a little bit longer too. Just letting the teachers know, if you finish a class early, we do recommend going to the next class, if that's how you scheduled your day for vision screening. Some schools like to do, okay, I'm going to do first and third this day, fifth and K5 this day. If you do them all in one day or over a course of 2 days, we recommend going right into the next grade if you have that scheduled, just because it can fluctuate and you might need a little bit more time for the next class too. Okay, this is one too where we can discuss this further. If you are interested in something like this, we can look at it as well too. With our school districts across the state, if it's public, private, or parochial, does not matter. We partner with university and high school students throughout the states and in different communities. And what we do is we train and certify them as certified vision screeners, and they then can go in to help the school nurses out, health aides out with those vision screenings as well. With that, we do want you present in the room with them just to oversee and make sure things are going well too. But it is nice to have that extra set of hands as well to help with the vision screening process. So with this, we do partner with university and high school. If it's high school, we try to match it up with the feeder schools for those elementary schools. So I mentioned before, HOSA, Key Club, National Honor Society, those are all clubs that we can train and reach out to help facilitate vision screenings for your schools too. All right. If possible too, we do recommend, if you can, recruiting some volunteers such as parents or teachers aid to just help with the flow of the vision screening that day. Even if you don't have university students, if it's the Lions coming in and helping out, or high school students too, it's just nice to kind of have that runner that goes to the classroom, collects some students and takes them to the vision screening room for you. It saves a lot of time. It's great to get steps in, but it can help you a lot if you're vision screening the whole day or a couple of days that week or the entire week too. So we do recommend a couple of parent volunteers or teachers aides to really help take those students to and from the classrooms, or you can have the teacher ask the teacher if they can allot some time to take their class to you as well. With that, we just ask, keep the noise level down, or keep them, if it's in the hallway, and just take students in as you screen them, just so you can hear them during the vision screening too. This is a great one too, where when we work with our preschool population, parent volunteers before the screening start can go into the classroom and review the shapes with the students of, okay, we're going to play a picture game today. This is what we may see. You can have university students do that too, or high school students as well. All right, when it comes to choosing a location of your vision screening, these are some recommendations that we have. So in a perfect world, it would be wonderful if we could get a library or a spare classroom to be in. We want to avoid a lot of windows if possible, just because of glare, but can easily pull shades or adjust the room and hang the chart if it's not directly by the window too. With this, we just want to make sure we don't hang the chart over the window. It just can be a lot of glare for the student. Sometimes we've seen people do it in hallways too. That's fine. If it's passing period though, or if a class goes by, it can get a little distracting, but really we say what works best and what is available for you as well. You can pretty much make most things work. We really just don't want to have, if we're using the charts, a dark room. If we're using instrument-based tools, then yes, that's something we may want to look at. We cover all of that in our training too, but one area we want to avoid if possible is the gym. A lot of echoes. So hearing, especially our preschoolers, can be a little bit more challenging, or if it's lunchtime, a lot of times that's not a good setup as well for vision screenings too. So screening location, what we would like is nice, bright, even lighting if possible. Avoid loud noise levels and a lot of distractions too if possible. Next, once we find the location, we want to determine the number of screening lanes we want to set up and run. So with this, it's just going to depend on probably the amount of helpers or volunteers and screeners you have that day or for that week. And also to the number of students as well. So with this, If you have students that can come in and help you vision screen, we see 2, 3, 4 screening lanes set up at a time. We typically have 2 people per screening lanes, especially for our preschool population. We do need 2 per screening lane. If it's just the wall chart for our school age students, you can get away with 1 person as well. I mentioned this a little bit before with the noise control and noise level. We just want to manage the number of students coming into the vision screening room when it's taking place. If we can, avoid having them come in all at once. If the teacher comes with them though, typically, it is a pretty good noise level if they're with them. We just want to make sure we limit distraction. Kids aren't made fun of too if they're really struggling during it, and really just help them with the whole process. A lot of them are nervous to begin with, so having their friend breathing over their shoulder or screaming out what they see is not something we really want to promote for them. So we recommend just bring the students in that you can, or have that teacher present or someone present to keep the noise level down too. Okay, so after the vision screening, we want to make sure we document the results. So is the student a pass, or are they a referral from the screening? So each screening lane should have a copy of the class list, all right? And then if you have multiple helpers and screeners that day, we want to take those class lists and create 1 master copy. It's just going to help you with the process of who passed, who didn't for this class, and documenting that too. Some schools like to enter in pass referrals in Infinite Campus. Some people just like to have their paper copies. It's really up to you, but what we recommend is the paper copy, and then if you are going to transfer it, to do that then on into Infinite Campus or whatever database you may be working with too. All right. When it comes to students that don't pass, we do recommend sending home a results form notifying the family that the student did not pass the screening. It really depends on the school. If you want to send a results form home with all students, whether they passed or did not pass, it's really up to you. We typically do it for the referrals though. And with this on the results form, we want to note the screening date that the child was screened, their results, and if they are a referral, what happened during the screening. So typically which eye was referred, and if there was any observation. So, Courtney was really struggling to see the wall chart, or she was squinting. Any type of detail that you or screeners that are helping you can put down. We find that actually helps parent and caregivers take their child into the eye doctor more quickly than if we just have the referral box checked too. If you do have a student who is absent the day of the screening, we do recommend vision screening those children on a different day. All right. We've seen people do it in their office. If you have the space, especially if it's first grade and older, you do need a 10-foot lane to measure between the child and the wall chart too. But we do recommend vision screening absences a different day. This is just a sample of a results form. So it is a Word copy too, so you can adjust it as you need to. If you find, oh, this is really helpful to add this in for parents, you can certainly do so. This is just a template we came up with for our partners. So at the very top here, it will say site, date, when the screening happened, what tool was used, and then you can see you add in the child's name, their age, do they wear glasses. If you do send home the results for those that passed, you can check the box pass and nothing more needs to be done. Or as we get down to the results, for those that are under the age of 6, we would choose this top box here or second box and circle which eye they didn't pass in. And for those that are over 6, so first grade and older, we would document their acuity score, and also to write down any observations. So it's really the top half of this form you would fill out. And then the bottom half of the form, the family brings in if the child is able to get in for an eye exam, and the eye doctor fills this out, and we're able to track any diagnoses that might be occurring for that student. And then on the back side too, it's nice, it's an educational piece, what families should do if their child doesn't pass and they're not sure how to make an eye doctor appointment or how to get connected, what their insurance covers, maybe they don't have insurance. So we do list that out for them as well too. Okay, so that's the basics of vision screening setup, choosing your date, what you will need, how much time. So as I went through that, are there any further questions that I can address? Okay, I got one question. So the forms were sent out to you guys. It was via a zip folder. Some of them did bounce, I found. So I tried to send them again this morning too. If you did not get any of the resources or the email I sent out, please put your name in the chat. And I'm going to try to find some different ways to send these over to you. I just think, like I mentioned, different firewalls can affect how people get the resources and the emails too. So just put your name in the chat if you didn't get the email or any of the resources, then I'll make sure that I do that today and try to find some different ways to make sure you get these too. Alrighty, perfect. So next section that we're going to go into here is just vision screening protocol. And we do cover this in our training too extensively, but I just want to talk through this briefly with you. So vision screening protocol, it's extremely important to make sure we're using proper protocol. Prevent Blindness Wisconsin, our national office, the National Center too, wants to ensure that if we're out vision screening, we're doing it accurately and we're doing it correct. All right. So when it comes to our preschool vision screenings and students, that's 3, 4, and 5-year-olds. There are 2 approved methods to vision screen our preschoolers. The first one is our chart-based method, and that's monocular measure of visual acuity. Okay. And with this, the approved method is the eye check booklet. Some of you may have, if you've been with us for a while, it's called the VIP wheel to screen students. That's still approved to use. But the most up-to-date is going to be the eye check booklet. I think it's a little bit easier than the wheel myself too, but it's really personal preference for you. If it comes with like, some of you have been with us, if you using the stereopsis or trying to test for color blindness, that is protocol that we don't use anymore. You can still try to do color blindness and I can cover that here. But stereopsis we don't use anymore just because the booklet really kind of takes them in and should do what that stereopsis does as well. We just found the results of if a child didn't pass the screening with the booklet, they would not pass stereopsis. So it's just condensing that screening down and making it more efficient for you. So monocular measure of visual acuity, the eye check booklet is what we consider gold standard screening. Okay. Instrument-based screening tools, though, are approved protocol too for our preschool population. So that's the Plus Optics, the Spot. Some of you might have the Sure Sight floating around. We don't see that too much anymore. A couple school districts have that, but really Plus Optics or Spot are the screening device we see. And these are the 2 devices that have been approved to vision screen preschoolers. Okay. I get a lot of questions on iSpy 2020. All right. That is one that is approved as well. However, I am going to make this note for you. iSpy 2020, you get a free trial or a discounted trial the first year. But then after the first year, it does get very pricey. Okay. So you are able to use it. It actually is a program that you pull up on the computer and a student goes through different activities and it will tell you if they're should be referred or if they're passed. The issue we have there is 1, like I said, it's very costly per student, and 2, it's hard for some schools to find a lot of computers to vision screen students as well. So if you're doing one computer at a time, it can get a little bit more difficult too. So I just want to put that out there. Some CSAs have been addressed with that of getting the iSpy 2020. It is something that can be used, but we just find it a little bit more difficult for our partners to navigate and implement too. Okay. All right, getting into our first graders here. So this is school-age children 6 and older. The only approved method to vision screen school-age students is monocular measure of visual acuity. Again, that's our chart-based method, and that is our Sloan wall chart with appropriate occluders. Okay. With this one, I am going to mention, so we do get a lot of questions, and maybe you have been addressed with this too. Courtney, can we use the plus optics or the spot on first graders and older? It is not approved protocol. All right. There is no scientific evidence to support that being a approved screening method for school age students. So if we're out screening, we want, like I said, we want to make sure we're doing it accurately. If we're doing it, we want to make sure we're using the proper method. So the tools are only approved for 3, 4, and 5-year-olds. First grade and older should just be the wall chart. Another thing that we've been asked here is, okay, I found though that the plus optics, they're integrating for them to test for refractive errors. So that would be myopia, hyperopia, astigmatism. Like I mentioned, there is no current evidence supporting that that is an effective screening tool. If there is evidence and studies that are done out there in the next year or so, and it does change, I will certainly let everybody know with partners, but currently that's our protocol right now. Let's see. I want to see if there's anything else I want to mention on that piece of things for people. I don't think so. I'm going to stop sharing and I'm just going to show everybody to the different charts. So this here is going to be, I wonder if I can spotlight myself. Yes, perfect. So this, oh, this is blurry. Hold on, everybody. 1 second. How do I take my blur off? There we go. Okay. Sorry for that little detour. So right here, this is our iCheck booklet. So this is going to be the booklet that is approved for our preschool population. There's 2 booklets that come in the kit, and I'm going to cover that here in a second on how to order these and how you can access these. One is for 3-year-olds, one is for 4 and 5-year-olds. Okay, so this is the iCheck booklet. It should come with occluder glasses too, and a lap card. All right. The iCheck booklet here, really what this does is, one, it tests a child's visual acuity. So how far can they see a set symbol at a set distance? All right. How clearly can they pick that up? And it also tests for amblyopic risk factors. The main difference between the iCheck booklet here and the tools is the tools are only checking for those amblyopic risk factors and pupil abnormalities. So that's going to be the main difference. These guys here, that's why we consider these the gold standard. These check for visual acuity and those amblyopic risk factors. The tool was just designed to test for amblyopic risk factors and pupil abnormalities. So like I said, with refractive errors, yes, I know Plus Optics put in that they can test for refractive errors, but currently we don't have any science backing that up. So if it does change, like I said, I'll let everybody know. And then for first grade and older, this is our approved Sloan chart. Some of you might have a little bit more of an outdated version if you've been vision screening with us for a while, where it has the big NDC at the top. All right, this is the approved chart. They changed this over for protocol, I believe, about 2 years ago now, where they adjusted the spacing here for students, and we are just starting at the 2100 line, not 2120. All right, and then the backside we have our symbols too. All right. Okay. When it comes to protocol 2, I do want to mention this. So we do mention this in our training, but when it comes to school age students, so we get questions, okay, if someone doesn't pass their screening, Courtney, should I rescreen them? With the iCheck booklet, if you are screening a child with this, you should not have to rescreen them if they don't pass the first attempt. All right. With the Sloan wall chart, though, for first grade and older, if a student does not pass on the first attempt, they do need to be rescreened. So what are recommendations for rescreen? If you can rescreen them at a different date, they do find it best. However, just capacity wise and practicality wise too, we have a lot of our partners and even us as we're out and about doing screenings, we rescreen the student that same day. So typically we want to give them a little bit of a break and then send them to a different screening lane to rescreen. The reason we rescreen is one, it helps with over referrals. Two, some kids are extremely nervous to come up to the screening lane and they may pass the second attempt. And two, though, kids' eye muscles are extremely flexible. So the first attempt here, they may be able to adjust the eye muscles. So what we want to do, and that's why they recommend at a later date or later in the day to rescreen them if possible, we want to make sure that we're getting that accurate. So if they're focusing on schoolwork for, say, 6 hours during the day, that screening is going to look a little bit different for them. So we do want to rescreen school-age students if they don't pass the first attempt. So I just want to mention that. With the iCheck booklet, you should not have to. With the Spot or the Plus Optics 2 instrument-based tools, if it is a referral, you shouldn't have to rescreen. If it's something where you're not getting an accurate reading or it can't pick up on the child's eyes or pupils, we recommend trying that 3 times with the tool. If you still can't get a pass or refer out of it, we recommend going to the iCheck booklet as a kind of that backup method. Okay, so when it comes to ordering our charts, a little bit of a different method that we have. You would in the past go directly through our office. Now we're having our partners go directly through school health. All right, so with this, we do have a sheet we put together on how to order the different charts as well. iCheck booklet, occluder glasses, occluder paddles if you need them. So we listed out the item number. You'd go directly to the school health website, type in the item number that you need, and it should pull it up right away for you. When it comes to the Spot or Plus Optics, I did provide links in here too. So the Spot is manufactured by Welch Allyn, so you'd go directly through the manufacturer. The Spot runs about $7,000, so they're not cheap tools to purchase. The Plus Optics, that is about between, we've seen if you get the S12R, that one is going to be about 300, 350. If you get to the S12C, that one is running about 500 to 700 depending. So you would purchase those directly through that manufacturer. And this is the Sloan wall chart and occluder paddles too if you need those. All right, so I'm going to go through follow-up then. So if you have a student that does not pass their vision screening, as a certified vision screener, a required step we do ask you to do is to follow up with that family to make sure that student can get into care. So with follow-up, it looks a little bit different. So follow-up really is steps that we take to ensure that child was able to get into vision care, to see if anything came about the vision screening referral and if they need further treatment or glasses for them too. So when it comes to follow-up, there are a couple attempts we can do. So getting in touch with the parent. So typically the first touch is that results form or letter that goes home saying Courtney didn't pass her vision screening that day. When it comes to attempts with follow-up, it really depends on what works for your families and the community you serve too. We typically see people do a 3 to 4 touch approach with follow-up. So the first touch again would be that results form going home. About a month or so later, we recommend touching base with the family again, and that can be via email, phone call, a message through Infinite Campus. If you guys have text messaging systems, we find that's pretty effective with parents nowadays too. The third touch would be about 3 months after the vision screening, and then lastly about 5 months. Like I said, this is going to vary across the board with our partners. Sometimes you only need that one results form that goes home and you're notified that they got in. Really, it's just to make sure, did they get in? And if they did not get in, are there barriers preventing that? So different follow-up methods, like I mentioned, phone calls, having the teacher mention it at parent-teacher conferences is another one that we do see too. Push notification on Infinite Campus or another online platform too. The one thing we do want to flag is if a child did not go into the eye doctor, that we want to touch base with them too at back to school time to see, okay, maybe over the summer months were they able to get in? And if not, really making that more of that higher priority for them as they begin their school year too. So these are just samples too. This is a letter that could go home to the student. It's very similar to the results form, but it's just a little bit of a different approach for follow-up. All right. After follow-up here, we do ask every one of you as a certified vision screener to report your vision screening numbers. That is extremely important for us to showcase the work you do. You don't have to vision screen in your community, and you do it. And we are extremely grateful for that. So with this, though, for us to continue the programs and the support, we do ask you to submit your numbers, just because the funding we get is through foundations, it is through donors. There's no state funding for us to facilitate the programs and partnerships that we have. So that's why those numbers are extremely important for PBW, and also to us to emphasize the partnerships that we do have as well. So there's a couple different methods. Our fiscal year runs from April 1st to March 31st. Typically, we do a push in February, March for vision screening numbers, and then we start to do more pushes April, May as well to report your screening numbers too. I know some schools do vision screen into May. As we mentioned, that's fine. This child is getting a vision screening, and that's the win at the end of the day. So you can certainly submit those in the summer months too, or as you come back for fall semester as well too. Couple methods you can use to report your screening numbers. We have an online submission form, so you can go right online and put those in. You can email the form to me, you can fax it, or mail in a copy too. This would be a sample of the form that we do have. So you can see it lists out by grades, number screened for aggregate, and number referred for aggregate data too. And this would be the backside if you do know of any diagnosis or treatments that your students have had too. All right, I do want to mention too, we do have a vision screening toolkit for school nurses. So that has all of the materials too that you would need to implement your vision screening. It has our CVS study, why proper protocol is set in place, and the science behind things. It has happy feet, if you're using those to vision screen for students to stand on, follow-up letters, education, fact sheets. It's a really good resource, and we put those together for all of our partners too, not just school nurses, but university students, Head Starts, childcare centers too. So that is right on our website under our partner resource page. And I provided the link here too. All right, so I'm briefly going to go over different vision care resources that we have. So with Badger Care Medicaid, Badger Care does cover an eye exam and a pair of glasses and one replacement pair of glasses every year for a child. It's the same for an adult too. So if they do have Medicaid, we do really want them to use their benefits, because we don't want Medicaid to review vision benefits at the end of the year and think, gosh, only half the people use their vision benefits, we're going to take that away. So we really want to make sure people use their benefits, just so we have that resource and program moving forward for them too. And what we've done is we really try to step that out for families. So included in all the resources too that I've shared, we have a how to make an eye doctor appointment with Medicaid worksheet, and it walks families through how to figure out their HMO. That's probably one of the biggest barriers we see, is they just don't know their HMO, and also to how to find clinics that take that HMO too. So we're not just teaching them how to access vision care, we're teaching them how to navigate the whole system for primary care, behavioral care, whatever they may need to. Another resource that we do have is our Children's Vision Care Voucher Program. So with this program, it does cover an eye exam and glasses, or just a pair of glasses, depending on the child's needs, every 12 months, as long as the child is eligible. So when it comes to our voucher program, we have one application for all the programs that they would fill out. We have this in Spanish and Hmong too. And with this, it can be found on our website, but like I said, I included this in all of the languages in the resources too for everybody. So to submit this, you would just need to fill out the application in full on the front page. And for submission, you can email it to Sam. She oversees all of our children's vouchers, fax it, or there is an online submission where you can submit it online too. Sam does need to send you that link, but that is another option for you too, just for convenience, or you can mail the application in too. So for criteria for the eye exam and glasses program, what needs to happen here is the family income needs to be at or below 200% of the federal poverty level. So essentially we have a question on there, does the child qualify for free or reduced school lunch? If they do, you check that box, and typically they are approved financially for the program. They cannot have any Medicaid or any other vision insurance. They have to be 19 years or younger and not graduated high school yet, and they cannot have used the voucher in the last 12 months. So say they use the voucher and it's month 11 of using the voucher, they have to wait that last month to be eligible again. On our website, these are available. As I mentioned, I sent those out via the resources too, but these actually can be found if you are a NASN member too. They actually are on the NASN website as well too. So I kind of put the breadcrumbs in here for everybody too to find those as well on there. The eyeglasses only program. So there's two different programs we have. So this is mobile eyes material only. This is mainly for more, I would say, rural communities. So with this, family income has to be at or below 200% or qualify for free or reduced school lunch. They have to have a valid eyeglass prescription that is less than a year old. And we do ask for that prescription as well, and the date of the prescription too. They cannot have had any vision or eyeglass benefits or have to have exhausted them and not used the voucher in the last 12 months too. And then our Healthy Eyes program, this is for eyeglasses too. We typically see this is more so with students. Let me backtrack here. We typically see this being used for more, I would say, urban locations. So like Provision, Target Optical takes this program. So it really just depends on kind of where the location is for the student that's applying and what voucher is being used, but both programs cover an eyeglasses for the student as well too. Some other vision care voucher, vision care resources that we have. So on our website, under our resources section and family individual, we do have a lot of resources for parents. So we put together some materials, especially when it comes to screen time in the eyes, and just to educate them on how the effects of screens can have on children's vision over time. We put together vision milestones for babies during the first year of life, what to look for healthy growth and development of the eyes. The ABCs of vision health, some warning signs for parents and caregivers to look for too. We also have county eye care provider guides for families. So our office did research, and in each county of the state, we researched all the vision clinics and took it a step further, asking, do they accept Medicaid, Medicare? Do they see kids ages 3 to 5? Do they have translators on staff? Just as another option and resource for families to go to. The process of making an eye exam appointment isn't easy. And so we want to make sure that it is streamlined and a little bit more easy for them to navigate to. We also have vision and eye health curriculum. So our team put together vision health curriculum for 3K, 4K, 5K, and 5th grade students. And really the hope is that the teacher then can then implement some of the lessons before the screenings occur, And then I believe there's a lesson or two after the screening occurs. So it's getting kids to talk about their vision health, advocate for their vision health, and just get used to what might be coming up for them when it comes to the vision screening too. So these are all free to access. This is a resource too that we have. We can share with teachers, we can share with schools. So if you are interested in this, please let me know. We would love to get it out in every school that does vision screenings, just as another resource for them to use. And it does meet the Common Core Health and English standards. And lastly here, I just want to promote the use of success stories. So we love success stories. I believe all of our partners love success stories too. And it really just helps share the good work that you do. So our success story form is right on our website. It's a questionnaire. If you know a student got into care, we ask that you share that with the family and the family fills that out. If they share it with you, to share it with our office, or a lot of times we get it in and we'll share it with the partner that we know is associated with that school or student too. So it's not just a simple pair of glasses for students. It really can help kind of change their whole perspective and quality of life too. With the success stories too, if we get them in, we do send out if we get a picture with it, we do send out a book for the child. So a little neat and program and a little neat incentive for them too. All righty. That is everything I have this morning. We're closing in right at 9:58, so that's great timing there too. And let me stop my recording here too.